my name's Lexi. I'm going to be your nurse today. I'm going to wash my hands. Can you tell me your name and date of birth? Bob Owens, 12/12/1999. Do you have any allergies, Bob? No? Okay. Well, I'm going to go ahead and I'm going to provide for privacy. And then I'm going to wash my hands. And then I'm going to make sure that I tell you what's going to go on. So today we're going to be doing IV administration through your central line. So you're not going to feel any pain, and what we're going to do is, the reason you have it a central line is because of you have dialysis. And if you don't understand, so do you have any questions? And if you didn't understand, then I have a second nurse in the room, and if this was a pediatric patient, then I would make sure to tell them that there's going to be no needle involved and demonstrate on a teddy bear. So now what I want to do is I want to check my order. So I do have an order for Bob Owens for hydromorphone 1 milligram IV push every 3 hours PR from pain. So I did check and I made sure that he had not had it 3 hours before, so it's due. And I checked my expiration date. I had my hydromorphone, that's good. Expiration date of my salines are all good. So now, and if there was a saline cap, then I would make sure to, with the antimicrobial effect, I would go ahead and put that on before I would take that off, and then before I use the center line, and then I would make sure to put it back on after I was done. But in this case, we don't have that today. So it is compatible, the hydromorphone is compatible with normal saline. I looked them up in my Betty book. I'm going to give the med over 2 to 3 minutes. There's no need for dilution. The adverse checks I'm going to be doing would be for respiratory distress, so because that's a side effect. So respiratory rate, I'd monitor, blood pressure, dizziness. So now what I want to go ahead and do is I'm going to wash my hands. Then I'm going to assess my IV site. So I can see it's covered. So I want to go ahead and check for infiltration, any tenderness, you feel any pain, any extravasation, and there's none. So I'm going to go ahead, take off my gloves, and then I wash my hands again. And then I checked the wristband to ensure that we have the right patient as well. It matches up with the name and date of birth. So now what I want to do is I want to get dose accurate. So first I want to take my saline syringes, and I want to go ahead, get out all the air bubbles out of those, and I have 10 milliliters for my saline syringes. There's no air bubbles. Okay, so I have all 3 of them here. So now what I'm going to go ahead and do is I'm going to check my get dose accurate. So I can see we did our math and we have 0.5 milliliters that we need to get. So I'm going to wash my hands, then I'm going to go ahead and we can see I have half a milliliter in here. So now what I'm going to go ahead and do is I'm going to label with my date, time, and dose accurate. So hydromorphone 1 milligram, 1 milliliter. So next what I want to do is I would make sure that I would get all the air bubbles out, and you can see that I would make sure that I would do that. So now what I'm going to go ahead and do is I'm going to wash my hands, and then I'm going to go ahead and check with my MAR and get dose accurate. So I can see that I do not want to put on this until I get dose accurate. So I have Bob Owens, allergies to morphine. We have my hydromorphone 1 milligram IV push, and I can see we have 1 milligram IV push every 3 hours PRN for pain, and it hasn't had for 3 hours, and his allergies are to morphine. So, and that's what the patient stated earlier. So we have Bob Owens, allergies to morphine, hydromorphone 1 milligram, IV push every 3 hours PRN for pain, and I can see that he hasn't had it for 3 hours, and I can see that we have Bob Owens, allergies to morphine, hydromorphone 1 milligram, IV push every 3 hours PRN for pain, and it hasn't had for 3 hours. So Bob Owens, allergies to morphine, we have hydromorphone 1 milligram, IV push every 3 hours PRN for pain, and then hasn't had for 3 hours. And then I go ahead and I check the expiration date on each one of my each one of my checks. So we're good on the allergies. So now what I'm going to go ahead and do is now that we also need to do the date. So Bob Owens, allergies and morphine, 09/22/1933, hydromorphone 1 milligram, IV push every 3 hours PRN for pain, and then he hasn't had for 3 hours, and I checked the expiration date and we're good. So I did that for all 3 of my checks. So now I'm going to go ahead, now that I'm dose accurate, I'm going to wash my hands, and then what I want to do is I want to bring my saline flushes over, and then we want to make sure that if we were to have a lock, then I would unclamp the center line. So I unclamped it. Then what I'm going to go ahead and do is I'm going to sterilize it for 15 to 30 seconds per agency protocol, and then allow that to dry. And then I want to take my first normal saline, I'm going to go ahead and pull back, make sure the IV is patent, and it is. So now I'm going to go ahead and flush the 10 milliliters. And then let's go ahead and say that I flushed the 10 milliliters. You feeling okay? Yeah? Okay, good. So I'm going to go ahead and discard this. Next, I'm going to take my next alcohol wipe, and I'm going to go ahead and make sure that this is nice and sterile. 15 to 30 seconds. Allow it to dry. So next I want to do is take my hydromorphone. We're going to do this over 2 to 3 minutes. Alright, so we're going to do this over 2 to 3 minutes. So we're going to say that we did that, and while I'm administering this, I'm going to check for the blood pressure, respiratory rate, and any dizziness. You feel any dizziness? No? So no signs of respiratory distress, which would be a side effect of hydromorphone. So let's say I went and gave that over 2 to 3 minutes, and then I'll discard that. And then what I want to do is grab another alcohol wipe, and then cleanse it for 15 to 30 seconds per agency protocol. And then go ahead and allow that to dry. Next, what I want to do is I'm going to take my next saline flush. And I want to go ahead, and I made sure all the air was out. And then I want to allow the alcohol to dry. And then I want to go ahead and do my next saline flush over 2 to 3 minutes as well. Okay, so let's say I did that over 2 to 3 minutes. She's feeling good. How are you doing, Bob? Good. All right, so next I want to do is take another alcohol prep pad. I'm going to go ahead and cleanse the area 15 to 30 seconds. Allow that to dry. Now for my next saline flush, I want to make sure that I do it pulse. So I allowed that to dry. All right, so you gotta get nice and close to the camera. So it's a pulse and then pull back, pull off your thumb off the plunger. So you can see I got the pulse technique. So I would go ahead and administer all of this saline. And then, so I'm gonna say that I did. I'm gonna go ahead for time purposes. And then I would discard of that. And now next what I wanna do is I wanna do my alcohol prep pad once again. 15 to 30 seconds, allow the site to dry. And then what I wanna do is I want to monitor again for adverse reactions. But first what I'm going to do is I'm going to take off my gloves. And so after I'm done with this, I would want to make sure to lock the saline again. And then if there was a cap, then I would go ahead and put on the cap for the antiseptic. So I'm going to go ahead, I'm going to take off my gloves. And then I would wash my hands. And then I would make sure to monitor my patient again for respiratory. I would monitor the respirations, blood pressure, the heart rate. I would make sure to check for respiratory distress. Are you having any dizziness, Bob? No? Okay, well good. So now what I'm going to go ahead and do is before I came in here, I should have provided for biopsy. So now I'm going to make sure the patient is nice and safe, and so that they're in a low lock position with their call light. Then I'll make sure to document my findings and dispose of my supplies. So what I would document would be I would assess the site. So I would document the assessments for that. I would document any adverse reactions, and then I would go ahead and document the amount of milliliters that I use, and then the hydromorphone and what time that was at, and the amount of milliliters for that. And I would document that I used normal saline, and then I would document that how the patient tolerated the procedure, so there were no adverse reactions in this case. And then I would go ahead and I would dispose of my supplies in the appropriate spot, and then I would also document my after I got dose accurate, what I wanted to do was, you can see that this says hydromorphone on here, but I would make sure to put this on my syringe. So I would say hydromorphone 1 milligram, and then it would have the date and the time on my syringe. So I'd make sure I would do that, and then I would document that, and then I would go ahead and wash my hands, and I'm done with this procedure.